Hello and welcome to this presentation on the topic of university students' ability to assess misinformation about COVID-19. My name is Yulong Gu. I'm an associate professor of health science at Stockton University in New Jersey, the United States. My colleagues and I conducted this research last year during the COVID-19 pandemic, which is also a pandemic of misinformation. So against the pandemic backdrop, we were interested in university students' competence to use the COVID-19 information on the internet. We invited undergraduate students to complete an online questionnaire, and today I'll report on some data from this questionnaire study, particularly with a focus on understanding whether students were able to use the internet to assess the accuracy of misinformation statements. The results showed that 2/3 of the students were able to identify all three included misinformation statements as incorrect, and these students were more likely to have higher GPA and liberal-leaning political views, and to implement evidence-based COVID prevention measures, including mask wearing and not self-medicating on hydroxychloroquine. Now, a bit more details on the study background. We all know that the COVID-19 pandemic is an ongoing public health crisis in the US and globally. It has also presented challenges for the public to seek, evaluate, and utilize health information. This doesn't mean there's a lack of information regarding the COVID-19 disease. On the contrary, there is an infodemic of COVID-19 information, which was defined by WHO as an overabundance of information both online and offline. The term "a pandemic of misinformation" has also been used as a large amount of misinformation regarding COVID-19 prevention and management has spread via mass media, social media, and the internet. And the adverse health impact of this misinformation pandemic has been reported, ranging from mental health issues to fatal accidental poisoning due to self-medication. Meanwhile, university students may experience increased information needs during the pandemic, but they may have poor e-health information literacy, or e-HIL for short, which refers to their ability to identify their own health information needs and to find, evaluate, and use online health information to meet those needs. So this study aimed to understand how effectively university students can search the internet about COVID-19 information and what factors may be associated with the effective use of online information. The study data were collected via an online questionnaire during a 3-week study period between September 21st and October 11th, 2020. In this questionnaire, we designed 5 statement scenarios on the topics of COVID-19 prevention and impact. 2 of the 5 statements were based on correct information from CDC. The other 3 statements were misinformation statements based on remarks made by President Trump, who was in office during the study period. For each statement, students were asked to evaluate if it was true or false, and to provide a URL that they trust to support their assessment. We also asked students to rate their own e-health information literacy. This e-HIL measure was adapted from the instrument we developed in an earlier study based on Norman Skinner's e-health literacy scale, aka e-HILS, and Erickson, Baca and colleagues' health information literacy scale. If you are interested in these instruments, please follow the links on the slide to read more. Also included in this questionnaire are COVID-19 knowledge questions based on Zhong and colleagues' instrument, anxiety screening questions adapted from G87 and HAI, and questions regarding information-seeking behaviors and COVID risk management behaviors. The descriptive chi-square test and 2 independent sample t-tests were performed in this analysis. For the URLs, the URL adequacy was coded if a student used a valid, reliable, and relevant web page that provided useful and adequate information to assess the statement's accuracy. Then assuming the URL adequacy as gold standard and the statement accuracy answer as test, the sensitivity and the positive predictive value were calculated to answer this question. Are statement accuracy questions sensitive in detecting students' internet search ability? And spoiler alert, the answer is yes, according to our findings. Now, the first key result we found was about students' ability to identify misinformation statements as false, or not able to in some cases. For each statement, over 80% students were able to tell that the information was false. For example, on the first statement, taking hydroxychloroquine or chloroquine are effective ways to prevent getting COVID-19. So for this statement, 82% participants said this was incorrect. On the second statement, 99% of coronavirus cases are totally harmless. 87% recognized this was false. On the third statement, young people are almost immune to COVID-19. 88% said this was incorrect. And a total of 157 students, or 66%, were able to identify all three misinformation statements as false. In other words, the other 34% failed to identify at least one misinformation statement as false information. By the way, the links on this slide go to the video clips of original remarks, just FYI. Furthermore, when we compared the students who successfully identified all three misinformation statements as false with those who didn't, we found that the first group were more likely to have higher GPA and liberal views. They were more likely to implement evidence-based COVID-19 prevention measures, such as wearing masks in public most of the time and not taking hydroxychloroquine for COVID prevention. On the other hand, no statistically significant differences were found between these two groups in terms of COVID-19 knowledge level, anxiety levels, e-health information literacy level, social distancing behavior, or demographics. Across the three URL fields, an average of 66% of the sample provided adequate URLs, and most URLs go to government websites such as cdc.gov or media reports from news outlets. The sensitivity for the three statement accuracy questions ranged between 86% and 97%, and the positive predictive value ranged between 62% and 75%. This suggests that such statement accuracy questions are promising indicators for testing internet search and utilization performance. In conclusion, the findings of our university student survey suggest that 1/3 of students failed to identify some COVID-19 misinformation statements as false, and 1/3 failed to identify adequate web resources to support information accuracy assessment. The students' ability to identify misinformation as false was associated with implementing evidence-based COVID prevention measures. This highlights a need to train students in health information seeking, evaluation, and utilization, especially in misinformation assessment, in order to promote evidence-based health behaviors. The limitations of this study included convenient sampling, a relatively small sample, self-report measures, and no control group. We'd recommend that future studies on the topic of health information literacy consider controlled study designs. At the end of this presentation, we'd like to thank the students for participating in our study and to thank our university for sponsoring the conference participation. For further information on the study, please email me at yulong.gu@stockton.edu. Thank you for your interest.